Welcome to Medical Education Department, Mansoura Faculty of Medicine. I am Sarah Mazen, demonstrator at the department. Today, we are going to talk about direct observation of procedure skills or DOPS. DOPS is actually one of the workplace-based assessment methods that was designed to assess and provide feedback on our candidate while he is doing procedure skill in a real-life setting. So the candidate does the procedure and we observe him and give him immediate feedback. Procedure skill have wide range. It can range from simple procedure such as venipuncture to more complex procedure such as endoscopy. It can also be applied in foundational sciences like histology, pathology. We can observe our candidate while he is doing tasks like slide preparation and staining or using microscope. So the question here may be, what are the competences that can be assessed by using DOPS? Actually, we can assess multiple competences by DOPS, like general knowledge about the procedure, informed consent, pre-procedure preparation, analgesia and sedation, technical ability, aseptic technique, and post-procedure management, counseling skills, professionalism, and communication. And also the overall ability of the candidate to do the procedure. So to use DOPS in a real-life setting, first of all, as an instructor or professor, you start by selecting a procedure that is used routinely in practice. It has to be something important for our candidate to be competent in. Then we watch and observe our candidate while he is conducting this procedure. After this encounter, we rate the trainee's performance of certain competencies using the DOPS form. And then we provide him with educational feedback. It's very important to provide feedback after each encounter to identify strengths and weaknesses and areas for improvement. Each encounter lasts for about from 15 to 25 minutes. The reliability improves with greater number of observed encounters. We may have to observe up to 6 encounters to have a good reliability. So we are not having a single shot of our candidate doing the procedure just once. No, we repeat this encounter multiple times to make sure that we can entrust this candidate in doing this procedure. We use the DOPS form to assess our candidate. So the form consists of multiple parts. The first part is general information about the evaluation date, the student name, the setting, and the complexity of the procedure and the name of the procedure. The second part is about the 11 competences that we will assess our candidate in. And each competency is rated from 0 to 9. 0 if it's not observed or it's not applicable to this procedure. 1 to 3 if it's unsatisfactory. 4 to 6 if it's satisfactory. 7 to 9 superior. After this rating, we give the candidate feedback. It has to be immediate feedback and it has to be constructive. So we will tell him details about what was good, what was bad, and what he needs to improve. DOPS have many advantages. One of them is that it allows direct observation of our candidate doing the procedure skills on a real life setting and give him immediate feedback. It also allows global evaluation, so multiple competencies can be assessed during single encounter. We can also customize it according to our specialty and our needs. As I said, we can use it in clinical science or foundational science. As regards the limitation, is that it needs faculty training, so that we make sure all faculty use the DOPS form in the same way to rate our candidate to improve reliability. We can also need to repeat the encounter multiple times to ensure that we assess all aspects of competences. And if the procedure is something technical or something complex, we may have to have expert observer observing our candidate doing it. Thank you for listening to this video.